Hello, Jennifer. My name is Jacob. I'll be your nurse practitioner today. How you doing?
Good.
Good deal. Okay. Well, what brings you in to see us?
My left knee has been bothering me.
Okay.
Some pain going on.
All right. How long's that been going on?
About 2 weeks.
2 weeks. Okay. Can you tell me what happened?
I was playing pickleball with my kids,
Ah.
and I got finished, and it started really hurting.
Oh my goodness. Okay. 2 weeks ago, playing pickleball. It's a good sport. All right. Well, I tell you what. I'm going to ask you a whole bunch of questions, do a review of systems, and then I will do a head-to-toe assessment on you. After which, we'll talk about what we're going to do about this knee. Okay.
Okay.
I just want to make sure that I don't miss anything, and if there's anything else that's going on. Okay.
Okay.
All right. First of all, can I call you Jennifer?
You can call me Jen.
Jen. Okay. All right. At any point in any of this, if you feel uncomfortable, please let me know. Temperature-wise, anything like that, just say something. Okay.
Okay.
All right. All right. So, how long have you been playing pickleball?
Oh, 2-3 years now.
That's
My
awesome.
kids got into it.
Good deal. Good deal. Tell me about your kids. How many do you have?
3.
Three.
3 boys. All boy all the time.
All right. What are their ages?
11, 12, well, almost 13, and 15. Just turned 15.
11, 12, and 15. All right. They're getting big.
Mm-hmm.
Okay. Keeps you busy.
Mm-hmm. Very.
All right. And you're married?
Yes.
All right. And what does your husband do?
He's a nurse, an ICU nurse.
Okay. All right. That's a tough job. Okay.
Yes.
So, how old are you?
42.
42. All right. And your date of birth?
3982.
All right. Okay. So let's talk a little bit about your personal health. Okay. Are you sleeping okay?
Yes.
All right. How many hours of sleep do you get every night?
Usually 6, 7, around there.
Okay. All right. What other kind of exercise do you do?
I walk with the dogs. I'm a project manager, so I walk job sites all the time.
Okay.
Quite a bit of cardio walking.
All right. How many hours a week do you work?
On an average, 40 to 60.
That's a lot. Okay. Plus with those kids, my gosh. All right. Do you sit down at a desk much?
Sometimes, but I'm also pretty active with it.
Okay. All right. Tell me about your diet. How do you eat okay?
Yeah.
Do you cook? Do you go out to eat?
Both. With kids, it's kind of 50-50.
Okay.
I like to cook when I have time.
Yeah. Just stay like healthy choices, or just kind of like run and gun fast food type stuff?
No, they're all athletes, so we try to stay on the healthier end.
Okay. All right. Do you guys go to church?
We do.
All right. How often do you go to church?
Every Sunday.
Okay. Do you have any spiritual or cultural things that I need to take into consideration? Any practices?
No.
No. Okay. Tell me about doctor's visits. Do you go to the dentist?
Yes.
All right. When was the last time you went to the dentist?
Last week I just had a cleaning.
Okay. What about the eye doctor?
Yes, once a year.
Once a year. All right. Have you had your hearing checked?
I have. Oh, excuse me.
Oh, okay.
Yes, I have.
Okay. And when was the last time you went to the gynecologist?
6 months ago.
Okay. All right. So let's talk a little bit. Do you have other health history? Any kind of like diabetes, hypertension, anything like that?
No.
No. What about your mom? Does your mom have any like high blood pressure, diabetes?
No, she's pretty healthy.
Okay. What about your dad?
He's deceased. He died when I was little.
Oh, sorry to hear that. What about grandparents? your mom's parents, are they still alive and healthy?
My grandmother is alive and healthy and great. My grandfather is deceased also.
Okay. No, how did he pass away?
Just in his sleep of old age.
Okay. When you say of old age, like how old was he?
80.
80? No diabetes, cardiac issues, anything like that?
No.
Oh, okay. Does your grandmother, does she have any heart history?
Mm-mm.
No. Tell me about your dad's parents. Are they still around?
I don't know. My dad died when I was little, so I don't really know. I never knew my grandparents on that side. I really don't even know if they're still alive.
All right. How did your dad die?
He was involved in a hunting accident.
Oh, gosh.
Yeah. I was little. I was like 3.
My God. Okay. All right. So, your health. I'm going to kind of go through all of your systems and just, if I ask you any questions that feel uncomfortable, again, just, tell me you'd rather not answer or anything like that, okay?
Okay.
Do you have any depression, any mental health history in your family, in your immediate family?
No.
Okay. Taking, like, when you shower and stuff, have you noticed any wounds, any, like, abnormal bruising or anything like that on your skin?
Mm-mm.
No? Okay. What about vision? Do you wear contacts, glasses?
Contacts.
Okay. Have you had any visual disturbances, any, like, blurry vision?
No.
Have you had any dizziness? No.
Mm-mm.
Is your hearing okay? Any kind of, have you been hearing anything, hearing any voices? Do you have any?
Just my 3 kids.
I bet. Mom. Any tingling or any ringing in your ears?
Mm-mm.
No. All right. What about smell? Have you had any kind of like strange smells, or everyone talked about COVID and the loss of smell? Have you had any of that?
No.
No. Okay. What about taste? Have you had any like weird, like something just doesn't taste like it usually does? Anything like that?
No, luckily I haven't. Even after I had COVID a long time ago, I never had any of those issues.
Okay, good. Speaking of COVID, just run through that really quick. Have you had, are you up to date on all your immunizations, like your childhood?
Yeah.
Smallpox, all that good stuff, measles.
Mm-hmm.
What about flu shot and COVID shot? Are you up to date on that?
Yes.
Okay. All right. Let's talk about your breathing. Have you had any trouble breathing at all? Any like shortness of breath? Any chest tightness?
No.
Noticed any wheezing or anything like that?
Mm-mm.
Okay. Have you noticed any like heart palpitations? Any like fast heart rate? Anything? No. Outside of exercise or?
No, does not. I haven't ever had any issues with that either.
Okay. Have you had any feeling of like being flush or any like like hot and cold disturbances?
No.
No. Okay. What about GI stuff? Any nausea, vomiting, diarrhea? Any of that recently? Any unknown? Okay.
No.
Have you noticed any weakness, any tingling, anything like that in any of your extremities or?
No, just this knee that was hurting is the first sign of weakness. I'm getting old.
Pickleball can be rough. All right, well that's good. Any pain or burning when you urinate?
No.
No. Okay. Any like abnormal bleeding in your menstrual cycles? Okay. And when was your last menstrual cycle?
I actually don't have them anymore. I have an IUD, so they've kind of gone away.
All right. How long has that been there?
A year and a had another one put in, and I've had this new one for about a year and a half.
Okay, all right. Okay, let's talk about that knee. So when it hurts, how bad is it?
Usually like a 5 or 6.
Okay, is it hurting right now?
No, I took some ibuprofen.
Okay, all right. You take ibuprofen. Is that what you've been taking normally?
Yeah.
Okay, how much do you take?
It's usually 400 milligrams.
Okay, you take it like on a daily basis, couple times a day, or?
Yeah, just when my knee is bothering me, usually kind of at the end of the day, it's very sore, it hurts.
Okay.
It's kind of hit or miss as far as when needed. Sometimes I'll take it earlier in the day.
Now you said your pain was like a 5 or 6. That's on a scale of like 0 to 10?
Mm-hmm.
Okay. When you take Advil or ibuprofen, does it take the pain away completely?
Yeah. Yeah, it kind of dulls it down. I don't really notice it.
Okay, very good. All right, and you haven't noticed any pain or anything in your right leg or like offset, anything like that?
No.
All right. Okay, I think that kind of sums up the review of systems. I think at this point, all right, we'll do a head-to-toe assessment. I'm going to ask you a whole bunch of questions, check cranial nerves. I'm going to check your strength, your pulses. I'll be touching your skin to see how, like, if there's any like lesions or any bumps or anything like that. If at any time in this you feel uncomfortable, just say something. We can defer assessments or whatever. Okay?
Okay.
All right. You feel all right?
Yeah.
Okay. So I'm going to first I will take a look at your head and your scalp, okay?
Okay.
All right. So looking at your hair, it is a nice pretty red. It's even throughout, no signs of any hair loss, any abnormal hair growth, the hairline is intact. All right, checking on your forehead, check your maxillary sinuses. Okay, little tap. Okay, that was your frontal sinus. These are maxillary sinuses, sorry. All right, all that's good. Okay. All right, you said you haven't had any kind of dizziness or anything. Okay. I will check your eyes. You say you wear contacts. All right, you have them in right now?
I do.
Okay. I'm going to check your pupillary reflex, your Hirschberg's. It's not being very bright, isn't it? I'm sorry. Okay, your corneal reflex. All right. I'm going to take a look from an angle. I'm going to take a look into your eye. Okay, let's see retina, the optic disc, macula is intact. You get vasculature. Alright, show you the other eye. Is that real bright? I'm so sorry.
That's okay.
Find a spot right over there. Okay, your other eye. Okay, I see the optical disc. Macula is intact. Vascular looks good. No sign of any aneurysms or anything. Okay. Alright. So I'm gonna check. So I saw that your pupils are equal, round, and reactive to light. So they have consensual reaction and direct reaction. Now I'm going to check the accommodation. So if I can get you to look at a spot on the wall,
Okay.
and then focus on the pin. Okay, very good accommodation. All right. Now I'm going to have you look at 6 visual fields. Okay. So just follow the pin for me. Alright, very good. Nystagmus is noted in both lateral aspects, which is normal. Okay.
Okay.
Alright, now take a look at your ears, okay?
Okay.
Okay, the external ear, there's no bumps or any exudate noted. We got 2 piercings, but the external ear looks good. Okay, take a look at this one. Alright, again, the external ears look good. There's no abnormal bumps, any lesions, there's no drainage, and 2 piercings as well.
Okay.
Take a quick look on the inside. Okay, and the internal parts are visualized. There's no fluid collection. Tympanic membrane is intact. The bony features look good. Same with this one. Eardrum is intact. There's no fluid collection. No signs of any kind of infection. Okay. I'm going to touch around your eyes. Just want to put gloves on really quick so I don't contaminate your eyes, okay? So your eyelashes are very even, very full. Lacrimal gland, alright. Okay. No excess tearing, no drainage. Do you have any kind of eye infections or anything lately? No. Okay, everything looks good. Okay, now I'm going to check your nose, okay? It's midline. There's no signs of any lesions, no abnormalities externally. I'll get you to close off one nair and breathe in and out, and then do the opposite, okay? Okay. All right. Patency is intact. Good. I'm going to take a look inside your nose. All right. It's right near. Okay. The nasal mucosa is moist and pink. No signs of any ulceration. Okay. Patient's left nair. Again. It's moist and pink. No signs of any ulcerations, no bleeding. Looks clear. Alright.
Tickles.
So, alright. Now, I checked your sinuses a little earlier. Now I'm going to trans-illuminate them, okay? You just look forward for me. Okay. Okay. Now I'm going to get you to open your mouth for me. Okay. Okay. All right. So eyes, ears, mouth. So your lips look symmetrical. All right. There's no growth or abnormalities or any lesions or anything on the outside. Okay. So here, if I look on the inside of your mouth. Okay. All right. So first, say ah for me. Say ah. Okay. Stick your tongue to the roof of your mouth. All right. Now stick it out. Okay. Tongue is midline. There's no abnormalities seen in the roof of your mouth. Now I'm going to take a look at your gums. Gums are pink. Teeth are straight. Gums look good. Okay. Your teeth are very white.
Thank you.
Okay, it's a good feeling.
I work hard at that.
Okay, so I'm going to move on to your neck. Okay, so your neck is even on both sides. There's no signs of any lumps or any lesions. All right, I'm going to check your pre-auditory nodes. Okay. Get your post-auditory nodes, your occipital nodes. All right. Check right up here. Supercervical nodes. Deep cervical nodes. Posterior cervical nodes. Okay. I got your tonsillar nodes. Your submandibular nodes. Your submedical nodes. Okay. All right. I'm going to check your carotid pulse. Okay, we got 2+ pulses on bilaterally. Okay, now I'm going to check your thyroid, okay?
Okay.
So, okay, I'll get you to turn your head towards the wall over here. Okay. And swallow. Alright. Now, the other side, am I pushing a little hard?
No, it's okay.
Can you turn the other side?
Mm-hmm.
Let me get you to swallow. Okay. All right. Okay. So now I want to take a look at your hands, okay?
Okay.
Show me, put your hands out like this. Okay, got some dark nail polish. The cap refill looks good. I can see some pink nail beds.
Yeah, I'm due for a manicure.
It works for my assessment. I can see them. Okay, show your fingers like this. Okay. No signs of any clubbing noted. All right. So do me a favor. We're gonna check kind of range of motion on your hands. So stick them straight out, move them side to side, up and down. Flip them back. Okay. Check your radial pulses. Alright, radial pulses are 2 plus bilateral. Check your brachial pulses. Brachial pulses are 2 plus bilateral as well. Alright, I'm going to check some strength, okay?
Okay.
So I'm going to get you to cross your arms like this. I'm going to grab your hand and you just go against me, okay? I'm going to go up, down, side, pull down, push back.
Oh, okay.
Very good, very good. So musculature is intact from the bilateral upper extremities. Skin is warm, tan in color, dry and smooth. No signs of any lesions. All right, let me check some reflexes, okay?
Okay.
All right. So first I'm going to do this side first, okay? So I'm going to check your triceps. Relax for me. Okay. Check your bicep. Okay. And your brachioradialis. Okay. And this one. Nice and relaxed for me. Alright. Maybe kind of just let it relax. There you go. Okay. And your brachioradialis on your right arm. Alright. Reflexes are all intact. Alright. Now I'm going to do a test. I'm going to have you close your eyes. I'm going to put your right hand out. I'm going to place something in your right hand and I need you to tell me what you think it is, okay?
Okay.
Alright, go ahead.
Paperclip.
Correct. Alright. And then your other hand. Okay.
Coin.
Yes. Okay, very good. Okay. Now I'm going to check your epitrochlear nodes. Alright. And then I'm going to check your axillary nodes. Okay. And this side. Okay. Okay. Alright, so that's your arms, that's your head. Okay. Do me a favor, I want you to puff your cheeks. Alright. Smile. Frown.
That's hard to do.
Alright. Cranial reflexes are intact. Alright, at this point I'm going to move around to your back. I'm going to place my hands on your back and assess your breathing. I'm going to, excuse me, have you say a couple words and
Okay.
alright. So looking at your breathing at rest, you're in no distress. Breathing is symmetrical. I'm going to take take a deep breath for me?
Sorry.
Very good. I'm sorry.
I was choking my spit.
The breathing is good, symmetrical on both sides. All right. Now I'm going to place my hands on your back. I'm going to test for tactile fremitus. Okay, so say 99.
99.
Say
99.
99.
99.
Very good. Okay. Now, I'm going to kind of tap on your back and listen for any kind of dullness. All right. So no signs of any dullness, resonance throughout. Okay. Now I'm going to take a listen. So listen to the diaphragm. Take a deep breath. Okay. Again. Very good. All right, now I'm going to listen on the lateral sides, okay?
Mhm.
Go ahead. Okay. All right, very good. Lung sounds are all good. No adventitious breath sounds. No wheezing or crackling or anything like that. I'm going to test what they call the CVA, okay? This is going to be a little thump right in the middle of your back, okay?
Okay.
1, 2. All right. Do you have any pain, any tenderness? Nothing? Okay. All right. So coming back to your front side. One thing I need to do with your neck is I need to test your strength, okay?
Okay.
So I'm going to place my hand against your head. I want you to kind of push against it. Same with your forehead and the back. Then I'm going to place my hand on your cheek, and I want you to push it with your tongue, okay?
Okay.
Okay. So up against it. Okay. Okay. All right. Okay. All right. Very good. Okay. When you do that with your neck, are you having any kind of pain, any tenderness, anything?
Mm-mm.
Okay. And just, I'm going to check range of motions, look both ways. All right. Nod for me. All right. Go around in a circle. Okay. Any cracking, any popping?
Mm-mm.
No pain noted. Okay. All right. Right now I'm going to test with the tuning fork. Okay, this is actually test your hearing. Okay.
Okay.
So I'm going to strike the tuning fork. I'm going to place it on top of your head. And I want you to tell me if you hear it more on one side or the other, okay?
Okay. No, either.
All right, another test I'm going to do is to test for bone conduction, okay? So I'm going to strike it again. I'm going to place it right behind your ear, right back here on the bone. And when you stop hearing it, let me know. Then I'm going to move it to the outside of your ear. and I'm going to test your hearing, okay?
Yeah. Yeah.
All right, very good. Let me do that again. Okay.
No. No.
So the hearing on bone conduction is half of that of the air conduction, and that's good. So one more test for your hearing. I'm going to do a little whisper test, okay? I'm going to tell you 3 words, and I just want you to tell me what I say, okay?
Okay. Cat, ball, blue.
You're exactly correct. And on this side?
Yellow, stone, purple.
Very good. Right, so hearing is intact bilaterally. Okay, I'm going to take a listen. I'm going to listen to your chest, okay? First I want to palpate and see if there's any masses anywhere. And I'm going to take a listen to your breath sounds. And then I'm going to take a listen to your heart. And at the point I'll have you lay down and I'll take a listen to your abdomen and listen to sounds and stuff and feel on your abdomen and stuff, okay?
Okay.
So, first I'm going to say, alright, so skin is tan, smooth, no signs of any lesions. Skin is warm and dry. Okay. Take a deep breath for me. Alright, breathing is symmetrical. Alright. Get you to shrug your shoulders for me. Great. Alright. I'll listen to the diaphragm. Okay. Take just a little bit bigger than a normal breath, okay? Okay. No adventitious breath sounds. No signs of any wheezing. No coarse sounds or anything. Alright. You doing okay?
Mhm.
Okay. Alright, let me get you to go ahead and lay back. How's your knee doing?
It's okay.
Okay. Alright. Now I'm going to take a listen to your heart. Okay. There's different parts of your chest that I'll listen to. Just different parts of the heart, the valves, and listen for any kind of sounds and things, okay?
Okay.
Alright. So first checking the precordial area. Feeling the pulse. Okay. Alright, I'll use the bell. The second intercostal space, right sternal border for the aortic. Second intercostal space, left sternal border for the pulmonic. Third intercostal space, left sternal border for Erb's point. Fourth intercostal space, left sternal border for the mitral area. And then fifth intercostal space, midclavicular line, the tricuspid. same with the diaphragm. Okay. Second intercostal space, right sternal border aortic. Second intercostal space, left sternal border pulmonic. Third intercostal space, left sternal border Erb's point. Fourth intercostal space, left sternal border mitral area. Fifth intercostal space, left midclavicular line, tricuspid. Okay. Now I'm going to take a look at your abdomen. Okay, so I'm just going to pull your shirt up a little bit. I'll keep you covered, okay? All right. Are you cold?
No.
Okay. So abdomen is flat. Skin is tan throughout, no discolorations. Skin is smooth and dry. No lesions noted. Okay. I want you to do me a favor. I want you to pick your chin up to your chest. Okay. All right. No signs of any discomfort, no grimacing. And abdomen is flat and even. Okay. So now I'm going to take a listen. After I listen, then I'm going to do the percussion where I tap on my finger, and then I'm going to do some light palpitation, and then I'm going to do a little bit deeper. Okay.
Okay.
If at any point it hurts or you're uncomfortable, please say yo.
Okay.
All right. Okay. So the diaphragm. Normal bowel sounds heard in all four quadrants. Now I'm going to listen to some pulses with the bell. Your descending aorta, your renal arteries, your iliac arteries. And since you're laying here, I'll go ahead and listen to your femoral arteries as well. Okay? Good pulses heard in the bilateral renal, the iliac, and the femoral arteries, and also in the descending aorta. I'm going to take a listen to your heart at the maximum point of induction, and I'm going to do that for a minute to get an accurate pulse, okay?
Okay.
Right at the apex of the heart. Alright, pulse after 1 minute is right at 72, okay? Okay, so listen to everything. Now I'm going to percuss and listen for certain sounds. So over your hollow organs, I should hear some resonance. And then over your solid organs, like your liver and your spleen, I should hear kind of a dullness, okay? I go in serpentine fashion. Okay. I'm going to do something called a scratch test. Okay. So I'm actually just kind of looking for the border of your liver. Okay. Okay. So now I'm going to kind of push down a little bit. At any point, if it's uncomfortable, just tell me.
Okay.
Any pain or tenderness?
Mm.
Okay. No masses or any abnormalities found in palpitation and light palpitation. So now I'm going to push a little harder, okay?
Okay.
Okay. So, any tenderness, any? Was that a little rough?
No.
Okay. No masses or any abnormalities found in deep palpitation as well. So I feel the border of your liver. Okay. I'm going to do what we call a sweep test, okay?
Okay.
So lift here for your spleen. Okay. And through the liver. Okay. All right. Okay. At this point, I think I'm able to have you sit up. Okay. I'm going going to check your lower extremities. All right. So looking at it, we have musculature is even throughout. Skin is smooth and dry. No signs of any lesions. How's your knee doing?
It's good.
Okay. All right. Now, check cap refill on your toes. Cap refill is good, less than 3 seconds. All right. Toenail color is the same as your fingers. Very dark. All right. So I'm going to check your dorsalis pedis pulses. I'm going to check your posterior tibialis pulses. Okay. I'm going to check and palpate your femoral pulse. Okay. Pulses are 2+ throughout. Like I said, the skin looks good. Let me test. I'm going to test what they call the anterior drawer test to take a look at your strength in your. It's going to test for like meniscus injury. Okay.
Okay.
So. Okay. And then posterior. All right. Radius. All right. Okay. Any pain in your calf when I do this?
Mm-mm.
Okay. All right. Just gonna check. Any pain in your calf when? All right. Bring your toes up. All right. Both of them. Okay. Push down. All right. Very good. Okay. Now this is the knee that's hurting, so stop me if this hurts, okay? But I'm going to find the joint there. I'm going to do the anterior drawer test. 1, 2, 3. No pain?
No.
Okay. And then the posterior drawer test. 1, 2, 3. Okay. No pain? All right. I'm going to do the same with your ankles. Ready? 1, 2, 3. 1, 2, and 3. Okay. The anterior drawer and the posterior drawer test is negative. Turn your foot out, push down. Okay, turn it in, push down. Okay. Test is good. Okay. At this point, I'm going to get you to stand up.
Okay.
I'm going to test your lower extremity strength. First off, let me see you walk just a few steps in the room, okay?
Okay.
Okay, gait is good. All right, can you do the same thing, heel to toe? Very good. Now walk back to me on your heels. Very good. Walk on your toes. Okay, very good. Okay, I'm going to do what they call a Weinberg test, okay? I'm going to get you to close your eyes. I want you to put your hands out here and turn them upside down, okay? All right. Let me get you to step just a little forward and not against the bed. Okay, what I'm looking for is that cranial nerve. I'm going to see if you do any swaying, and that's totally normal. Okay, very good. Very good. Okay. Now, I'm going to take a look at your spine. Okay. Spine looks straight and good. Let me get you to kind of lean over for me.
Look at the waist.
Yeah, with the waist, I'm sorry. Okay. Alright. Spine is straight and midline. Okay, stand up for me, straight up. Normal curvature. And cervical, thoracic, and lumbar region. Okay. Alright, let me see here. Alright, you can go ahead and sit down for me. One thing I want to get you to do, if you can lay back for me, and can you take your heel and put it on your shin and slide down for me. Alright, now back up. I'm sorry, when it goes down, can you slide it back up for me?
Oh, yeah.
Alright, let me see you do that on the other side. Very good. Okay. I'm going to test your strength in your hip, okay? So I'm going to take this. And again, if your knee's bothering you, let me know, please. So this is right here. I want you to push up against me. All right, and down. Very good. All right, other side. All right, push up against me and down. Very good. Okay. All right, let me get you to sit up again. Sorry. Oh, into the strength. Okay. And any of that, were you feeling any discomfort, any pain?
No.
Okay. All right. So we'll talk about that knee and probably get some imaging, take a look at it and see if there's anything going on the inside. Okay.
Okay.
I want you to be careful with Advil or ibuprofen. You know, it can cause some stomach bleeding and stuff, so just monitor how much of that you take.
Okay.
And you might want to alternate some Tylenol and ibuprofen and spread it out a little bit. Have you tried anything else to alleviate the pain, or is it just Advil that you tried?
No, I was just taking Advil as needed.
Okay. All right, so I'll put in orders for an x-ray and stuff. If it continues to bother us after some treatment plan, then we'll do maybe PT, OT, or if we need an MRI, we'll get an MRI. Okay. Let me see. Is there anything I'm missing? Anything that you want to tell me?
No, I'm just gotta figure out this knee.
Yeah, absolutely. Well, all right. Really quick, do you have any allergies to any medicines?
No.
Any allergies to any foods?
No.
Any environmental allergies, seasonal or?
Occasionally a seasonal allergy, but nothing regular.
Do you take any medicines on a regular basis?
No.
Okay. All right, Jen. Well, I appreciate your time.
Thank you.
You bet.